All right, everybody, welcome back to another episode of the Founders Cut. Today, I'm joined by Megan, CEO and founder of Prende Health. I'm super excited to have this conversation. We actually met through my managing partner, Amanda, so they had a chance to connect, and we got introduced from there. And so we were just super fascinated in the space that she was operating in. And so, welcome to the show. And I kick these things off by generally asking for the founder to kind of talk a little bit more about how they got to this point in their journey. So, would love to kind of hear the backstory.
Yeah, and thanks for having me, Adam. So I am Megan, CEO, co-founder of Prende Health. And what we're doing is we're building a platform that allows women to live their life without the burden of chronic reproductive disease. So we're really focusing on those conditions that cause moderate to severe symptoms for years, if not decades, of a woman's life, things like chronic vaginitis, PCOS, endometriosis, pelvic pain, you name it. And so for me, it's kind of a two-sided journey. I've been a patient myself for 4 years. Ever since it was time to go to an OBGYN, I've struggled with something called chronic vaginitis, which is essentially recurrent vaginal infections. So yeast infections, bacterial vaginosis, also urinary tract infections, which are incredibly common. Those three things are the most common reason for anyone to go to an OBGYN. And it's not uncommon for women to experience 3, 4, 5, 6, 7 infections over the course of a year. So I actually have traveled something like 20,000 miles between doctors over the last 4 years, looking for someone with answers. And as it turns out, I got the same type of care from each doctor, and that care really never worked. So I just really wanted to dedicate my work as an individual and also my work as an academic researcher at Princeton to creating a solution and finding a solution for patients like me. And so that kind of led me down the health tech route, down the women's health route. But for me as a person, I grew up in Orlando, Florida, where like if you're successful, you're a doctor, a lawyer, or a nurse. There's really no startup innovation, certainly not any health tech. We're not a big healthcare hub. And so I always wanted to be a doctor, and I kind of grew up in a low income household. Being a doctor was something that was financially sustainable and interesting, but always had that entrepreneurial side to me too. My brother and I used to do anything for the almighty dollar. We would say we would drive around and pick up scrap metal and take it to the scrap yard. Like a dryer on the side of the road was the equivalent of $10 in our pocket, and we didn't see it any other way. And so we would do that. And so I kind of grew up with that sense of like resourcefulness and just wanting to take something that people saw as nothing and turn it into something that I could use as a person and just live in that way. And so ultimately I went to Princeton for my undergrad. I studied evolutionary biology, went across the pre-med track and became really dissatisfied with it and went back to those roots and my passion for women's health. And that's really what brought me here to Prende.
That's an amazing story, and there's a few things I want to touch on, and I'll start with the ones where, I can relate to. I was also a bio major that he thought was going to go to the doctor track, and when the corporate world slash startup world, and then never look back. But in terms of like, I think something that probably drives you without you even saying it is just you want to make an impact, and so doing a healthcare company is a phenomenal way to make a potential impact for millions of people, right? You think about like the ability to scale your services to the doctor versus maybe a tech founder or a health tech founder. Both are phenomenally important in different ways, but it's kind of cool to think that like the track that you're on now might be able to help millions, if not billions, of women over decades, right? So very, very cool. I also love your backstory about like understanding the value of a dollar, right? I think like when I meet founders that you know, come from nothing, let's just say, for a lack of a better cliche, right? Similar to my family, we came here. My folks came from another country with 2 suitcases, and had to build it brick by brick. And I think that resiliency and that grit is something that is very, very commendable, and it's an intangible that not everyone has, right? So very, very cool in that regard. The last thing I want to talk about that leads into maybe a response from you is just, you know, I experienced a secondhand from helping a loved one through a health matter where I was kind of their driver, their second pair of ears and whatnot. And oftentimes, what you see from the healthcare system, and I'm not blaming anybody because the healthcare system's flawed and people are overworked and not everyone's skilled in the proper way. They teach you the science, but they don't teach you the art of interacting with humans sometimes. And so, like my guess, my assumption, and something I've heard a lot is just doctors that just kind of brush off the concerns and the and the complaints. I don't know if complaints the right word, but of the patients, right? And so is that a big part of why you started Prende Health?
It really is. And it's always an interesting question for me because I've been on both sides of the equation. I've been a patient for as long as I can remember. My dad was always sick. We always went into, the VA hospital for him. So I've always been on the patient side and on the caregiver side or the family side, like you said. But I was also lucky enough in my undergrad to spend a lot of time from a provider perspective, either shadowing because I was pre-med or, in the office because I was doing some research. And you're exactly right. What you find is that patients have a standard that they deserve to have met by their doctor. And then OBGYNs in particular are over capacity. They don't have a lot of research to back up. Like imagine you're a doctor and you're trying to work with some of the most complex issues that affect women. And there's only been research on it for the past 5 years. What are you going to do with that, right? And you don't have the cutting edge tools that cardiology has or that folks that are treating diabetes have. You are very under resourced in every sense of the word. So it is true, like medical gaslighting is a huge problem for patients with recurrent vaginitis, with any type of chronic reproductive disease, but also just the lack of capacity on the provider side for a number of reasons that are outside of the provider's control. So I have always been really excited about an approach that brings the patient and the doctor closer together so that both are better resourced in the ways that they need to get the care that they need. And ultimately, I do think that falls on making sure that the provider has the appropriate resources to provide care, because if they do, the patient's going to have more resources and she's going to have a better care experience. It's going to lead to a better care outcome. So Prende is actually, evolved. We've pivoted a few times like many early stage startups do. And we've ultimately landed on a thesis where if it doesn't include the provider, we're probably doing something wrong, because that's ultimately what's going to allow us to make a huge impact over a long period of time, not only for women, but also for doctors. And I think that's really important.
Yeah, I think startup founders often want to disrupt um, established processes, organizations, products, well, whatever the case might have been. However, I think you touched on a really important part, which is disruption is fine, but sometimes it needs to be a little bit of strategic incremental disruption before you can actually completely overturn the table and say this is the new paradigm. So I don't know what your Horizon 3 and 4 goals are for the company, but I commend you for looking at it from the perspective of Horizon 1 at a minimum needs to play within the structure that currently exists, because they're the ones delivering the care, right? And so I think that's right. You got to make sure that it can be a win-win-win for everybody. And so, yeah, I've seen a lot of great ideas kind of flounder because they focus purely on the customer or the patient, I guess, in this regard, but then didn't do enough to appease the payers and the providers as well. So I think that's a smart approach to it. So tell the audience a little bit more about how the product or the services actually works, for someone that might have be interested in learning more about this.
Yeah, certainly. So the way that Prende works is we provide the software system that allows OBGYNs to monitor and help patients prevent recurrent episodes of chronic reproductive disease. So we have a patient-facing mobile app that operates as kind of like your period tracker on steroids if you're a woman that's used a period tracker. We're tracking the symptoms and the health style behaviors that are relevant to you and your condition. And then we're providing really strong analytics on that so that you can make informed decisions about what behaviors are actually impacting your health. And then layered on that, because we believe that patients shouldn't be operating alone on that data, we have licensed clinical social workers, health coaches, and nutritionists in the app who can provide guidance based off of that data for you. So that's really like a whole person experience that your doctor and you want to be able to access, but it's really just hard to access for an affordable price in the current healthcare system. And then what we do on the doctor side is we take that information and we share it back with your doctor. And so they review that on a regular basis and provide you with an update of their clinical opinion of what is going on. So if your doctor thinks that everything is looking good, or if your doctor is saying, hey, it looks like you actually might have a UTI, I need you to come in for a culture today, rather than you waiting, 3 weeks from now when you're like, oh my God, I think it's progressed to kidney infection. We don't have to do that. So it's really proactive care on the doctor side by giving you what is a very consumer and patient-centric experience. And ultimately, we have worked to make all of this reimbursable by insurance so that you can access the care that you need and ultimately should be covered by insurance, because it's something that is quite fundamental to your ability to operate as a healthy person.
Yeah, I can totally imagine if you're not getting the right care and it's something that is never quite resolved, how much of a quality of life impact that would have on people. And so, yeah, the tools like this seem like a no-brainer, right? But yeah, but in reality, big systems are hard to change because it takes time, it takes patience, it takes someone that's willing to kind of have that grit to go after it. If there is just a, you know, random person on the street that wants to use the platform, they probably can't, right? It needs to be a service that's offered by the clinician side at this moment.
Yeah, that's right. So we did offer it completely for free to anybody who wanted to sign up for the past year, as we were just getting product feedback to understand the patient perspective. But as we've grown, we've really focused on partnering with OBGYNs. So one of the things that we are actually doing now is if you are a patient who wants to use it and you reach out to us, we will absolutely give it to you. And then we'll also ask you to provide a handout to your doctor to let your doctor know that you're using Prende. So we just as a patient myself, I want to make sure that every woman that can use the platform, touch the platform, get familiar with it, can. And ultimately, if patients are using it, it's not going to hurt our argument for OBGYNs. But yes, that the vision is that, whoever the woman interacts with, whether it's her primary care, her internist, or her OBGYN for her women's health concerns, we will be the service that's on that provider's computer and that patient's phone that's bringing them closer together to prevent those long-term symptoms that she's struggling with.
Yeah, I think that's a good approach. I did a startup in the pediatric healthcare space, and we gave our product away for free to families with kids, and the kids would then become our advocates to get it into the dental offices and the primary care clinics that we were trying to approach. And it's such a compelling use case because you know women talk to other women, men talk to other men. So if you have a product that works for people, that's the best ROI on marketing. We talk about this world of like paid advertisements and pay per clicks and all this stuff, and tried and true customer referral, word of mouth recommendation is pound for pound, dollar for dollar, the strongest one out there. So, I could see a world where this is a great marketing tool for OBGYNs, right? And, they might not think of it as a marketing tool, but from a business perspective, to me, it just screams it's a great marketing tool to differentiate from your competitors, but also just, get better quality scores from your patients, right? CMS is very, very focused on like what kind of services are you providing, not just checking the box, but also the look and feel of it too. So, that's I think you have a huge opportunity to like help move the needle on a lot of fronts for the caregivers that are out there. So, tell me more about how long you've been in building mode slash deploying mode. Like, what's the journey been so far, and maybe talk about some of the cool things that you're proud of.
Yeah. So I've been working on this for about 2 years now. And it has just been an awesome experience. This is my first company. So I was kind of, I think I built rather slow. And if I look back, I say I could have done everything I've done in 2 years and 6 months. But of course, hindsight is 2020. I am incredibly proud of a couple of things. Number one, I know it's really hard to even get to market with a product in the healthcare space and get patients using it. And a lot of founders that have mentored me, really prepped me as we were getting ready to go live about 7 months ago that you're going to put it out there and no one's going to sign up. And that's going to be fine. And you have to be mentally prepared for that. But we put it out there and we had 50 signups on the first day. We didn't run a single ad. We just put it into a Facebook support group that I'd been active in as a patient for chronic vaginitis. And we had 50 women sign up. And it was probably one of the most gratifying feelings that something that a website that I put together on Squarespace, we were actually fully HIPAA compliant. We put a lot of time and effort into security before the launch, but everything else was really just kind of put together super quickly. And we could convince 50 women that this was a problem big enough that they should trust us, to help them solve. And that was a really big moment for me because it was encouragement that we should keep on building and keep going forward. And even more exciting than that was when we got our first OBGYN to recommend our product to a patient. I went into the office, I gave them pamphlets, kind of like cold, they'd never met me before. And then the next day we had a sign up from the QR code that were on those very pamphlets. And to me, that was an indication of, okay, I know that there's a provider somewhere out there who actually really cares about their patient experience. And those were just early indications for me that like, hey, you could be scrappy in this field that seems like you need to have a lot of experience, or maybe you should have worked in healthcare before and I don't know, had a job at a payer or something. You could just be someone who took, 3 years of college and a leave of absence and is ready to go and build something from the ground up and actually get outcomes and make a difference for patients. So those are big moments for me. And we have a few big moments that will be coming up in the next couple of weeks. We're going live with our first OBGYN partners at the end of the month. So a big moment for us in like validating our monetization engine and validating our distribution. And we've run into so many problems, but also so many opportunities to like really refine how we're working. So it's coming up on another big era for us as we've kind of changed to pivot for first off how we make money into this new model, and also how we're distributing through OBGYNs.
Awesome. Well, one thing I want to throw out there, you kind of mentioned that you think you've been going slow, but in reality, I think you're right on track in terms of how long you've been building to get to market, especially in healthcare, right? I think there's this allure of going fast and breaking things, but when it has to come with someone's privacy and health, you can only you should do that, sure, but with some speed limits in place and some guide rails in place, right? So I think like to do this, to do what you've done in the space that you're doing it in 2 years is it's to me it seems like you're moving pretty quickly in my opinion. So I wanted to at least throw that out there. As you've been building this for the last 2 years and you've had some time to kind of like self-reflect on you as a founder, what would you say is your unfair advantage, your competitive edge, your superpower? I have two thoughts in my head, just, briefly getting to know you now, but love to hear what your thoughts are on it.
Yeah. So I generally think that if you want to be a founder, you need to master your own psychology. And that's just a non-negotiable because you're going to end up in really, really difficult situations that you're just going to have to stick them out. And that's something that I just enjoy doing as a person. I've always been really reflective and intentional and doing a process and going back and being like, how could this have been 10 times better? I really appreciate that process. And in doing that for myself, I think that number one, I could not do this if I hadn't been a patient myself for a long time. And if I hadn't also wanted to be a doctor for a long time. So I think that my inherent interests, like literally from birth, the things that I wanted to do to right now in this very moment have just been so aligned from all the perspectives for me to be a good health tech founder, because you're not going to get through without caring about a lot of different perspectives, unless you just want to build in consumer healthcare and charge patients directly. But that's something I don't believe in as somebody who grew up low income and couldn't have thought about spending $1 on a healthcare app, let alone any type of healthcare service. So I think that's probably the first one. And then the second one is just grit. I mean, I hate to say that I think that I have grit, but I think that that's the truth there. I really realized it when I went to Princeton for my undergrad, and I was like, oh, wow, every other kid that's here had a tutor for the ACT and the SAT. It was like the small things where I realized, you really just work on your own for not even 4 years of high school, but all the years of school. And then you build up a kind of like always have a chip on your shoulder mentality that for me now is necessary for success for myself, and maybe isn't for other people. They like to operate from a place of like more resources, but I really enjoy seeing a competitor come out from like a highly funded prestigious VC fund, and they're highly funded, because to me that's just another version of what I did growing up, which was living in kind of a more affluent area but not having the resources and still having to compete with those kids for the outcomes that I wanted, and I enjoy that.
Yeah, when you see competitors, I like to reframe it as it's validation that there's a problem that needs to be solved, and if money's flowing, that means that you're in the right space, right? Now it's easy to say as someone that's not chasing for those dollars, but you can't take every situation and just only see the negative. You got to figure out a way to turn it into positive. So I think you're right. You got to embrace competitors. You got to embrace the people that doubt you, the naysayers, all that stuff. You did hit on the one of the two that I was gonna say, which was grit, right? I think I can tell that's very evident immediately. And then the other thing I think that I see that's immediate is just passion, right? So I don't like investing in companies where founders don't have those two qualities. So I think like you've got the right foundational traits to kind of, because it's a marathon, right? You can't sprint to the finish line in this game. You said 2 years was a long time. Well, just assume it's going to be another 8, right? Because that's just kind of baseline for startups that exit. It's a decade long love letter to like society that you're trying to write on the fly with like a pen that doesn't work and a piece of paper that's probably ripped on the edges. But on the grit side, you're right. It's a skill set that's learned over time. The best analogy I have, and it's probably one that doesn't relate to everybody, it's like you're playing poker and there's 8 other people at the table. You get dealt a 2-5 offsuit, a terrible hand, a starting hand. Someone else gets dealt pocket pairs. Like, doesn't mean you can't win, but your chances of winning are harder. But it means you got to learn how to read the table. It means you got to learn how to bluff. It means you got to learn a lot of intangible skills that Some people that just have a better hand that's dealt to them, they don't have those skills, right? So it's something that I think more investors should look for when they're looking for deals to invest in. So so like I think you're spot on with some of your unfair advantages that you're leveraging. Um, as we get closer to the end, I want to give you a chance to kind of shout out to the folks you're trying to connect with, or even shout out the folks that have helped you along the way. Kind of just give you the opportunity to do both, or either, or none.
Yeah, no, I've been helped by numerous people. Gosh, so many people. First, all of the OBGYNs who took calls with me. It's just like I've done so many cold emails, it's absurd. And so anyone who responded to a cold email from me, but especially the OBGYNs that gave me the clinical backing, the ability to build a product that's actually helpful for patients. Um, those people mean the world to me, and a few really awesome mentors of mine, especially Blake Margraf from Care Signal, who's been super instrumental in helping me get things off the ground and helping me learn from his mistakes back when he made them and not make them myself, has just been an incredible help. And also, of course, my co-founder and CTO, Dimitri, who keeps me not only in check around security, things that I've never known but that he's built before, but has moved so quick to make a product that's incredibly complex and really is the lifeblood of blood of everything that we build and bring to market. Would love to shout those people out. And if there happens to be an OBGYN listening to this podcast, I'd love to talk to them, because what we're building is ultimately good for patients and providers. And right now we're looking to meet with providers who are interested in implementing something new and exciting in their practice.
Yeah. And I'll take it one layer further, because sometimes when people are listening to these, they think, okay, I don't know an OBGYN. Let's move on. If you know anyone in the clinical world, if you know anyone that might know somebody that knows an OBGYN, take 2 seconds to think if you got someone in your network that might be a good warm intro for Prende Health, right? And then if people want to get a hold of you, or the company, what's probably the best avenue?
Yeah, email me, MVL, my initials, at PrendeHealth.com. We're also super active. We have a great Instagram. So if you forget my email or it's not working, just send us a DM and someone will let me know that you're in there. But yeah, follow us on Instagram, follow us on Twitter, take a look at our website, www.prendehealth.com. And we'll be happy to connect with anyone who has thoughts to share or someone to introduce us to.
And then one last thing, for any aspiring founders or current founders that are kind of building their dream, their mission, their vision, any advice that you want to throw out there?
Just do it and don't overthink it. I actually started building Prende before, I was pre-med and I transitioned into this, entrepreneurship health tech world. And the catalyst for me to do it was I was just on a call with someone who was a femtech founder, and she was like, well, now's a good time. So if you want to do it, you should do it. I said, okay. So I got off the call and I started doing it. So just don't wait, just go and build something. But also I have learned a lot from studying the greats before me. So if I would highly encourage anyone who's interested and wants to be a founder to listen to podcasts, read books. Steve Jobs, Jeff Bezos, Estee Lauder, they're some of my favorite entrepreneurs. Like, learn about what those people did and try to emulate it in your own life. And for me, that's been really instrumental in selling better, building better, doing everything better. So that's the advice I'd have for early entrepreneurs.
Yeah, it's kind of cool to think that one flippant comment from a other entrepreneur, just go do it, was enough to like push the boulder over the edge that it was probably hanging off of. And so you just never know like what the catalyst is, but that's very cool to hear. Well, Megan, I really appreciate your time, really appreciate the candor, and just the energy you brought to this podcast. So thank you again for joining me and telling your story.
Yeah. Thank you, Adam, for having me.